time to check in, as we do every time this week on Wednesdays with Wagle. Dr. Jason Wagle with Kansas Perio and Dental Implants. Good morning, Dr. Wagle.
Good morning, Ted.
Hey, let's take a look at some of the risk factors. What are they for gum disease?
You know, Ted, the risk factors for gum disease, also called periodontal disease, fall into two broad categories: those that can't be controlled and others that can be controlled.
All right, let's start with the bad news first. What are risk factors that can't be controlled?
The most important one is age. According to the CDC, more than 70% of people over the age of 65 have some form of periodontal disease. Another uncontrollable risk factor is genetics. Some people are more genetically predisposed to gum disease than others.
All right, let's hit the other side of that coin. What are the risk factors that can be controlled?
Ted, tobacco use is the most important one. Studies indicate that tobacco use may be one of the most significant controllable risk factors in the development and progression of periodontal disease.
All right, what about diet? Does that play a role?
Yes. The American Academy of Periodontology advises that a diet low in important nutrients can make it harder for the body to fight off infection, including periodontal disease. In addition, obesity may increase a person's risk factor as well.
Well, I would imagine, so that's another reason to get into the habit of eating a healthy diet, right?
Correct. And speaking of habits, clenching and grinding teeth are also risk factors. Your dentist can help correct these problems that affect your gums, teeth, and bite.
All right. Are there any other behavioral issues?
Well, yes. Stress is definitely a factor as well. When you're under stress, your body has a harder time fighting various diseases, including gum disease.
And then what about medications?
That's a great question, Ted. Some medications, such as contraceptives, antidepressants, and certain heart medications, to name just a few, can be factors that affect your oral health.
All right, so boil this down. How can gum disease be controlled?
The key is early diagnosis. See your dentist twice a year and your periodontist as prescribed. Periodontal disease is preventable and treatable, especially in the early stages. At Kansas Perio, we emphasize prevention, and we routinely treat gum disease and save teeth when possible.
Sounds good. Hey, stay cool on this hot day, all right?
All right. Thank you, Ted. I will do my best.
You got you. Good to talk to you. That's Wednesdays with Wagle. Of course, that's sponsored by Kansas Perio and Dental Implants. Hey, when it's time to get serious about your smile, go to kansasperio.com. That's Kansas, Perio.com.